My name is, like you said, Camilla Foy. I'm from St. Petersburg College and I am in an early college program. And I will be talking about mental health and bullying in epilepsy. So just a quick overview of what I'm going to be talking about today. First, I'm going to discuss what is epilepsy for those of you who are unfamiliar with it. Then I will go over the basics of the disorder and move on to mental health in people with epilepsy. Next, I will discuss why might someone with epilepsy be bullied and the possible solutions. So firstly, what is epilepsy? Epilepsy is a disorder in which surges of electrical activity in the brain cause unprovoked seizures. So to understand what seizures are, let me show you what happens in the brain. In a healthy brain, your brain communicates by sending action potentials between neurons. These action potentials are fired at controlled rates, leading to normal brain activity. In a person with epilepsy's brain, the action potentials are fired at uncontrolled rates, causing a spike in brain activity, therefore causing seizures. Statistically speaking, 1 in 26 people will develop epilepsy in their lifetime. It is so common, in fact, that some of you in the room might have had an experience with epilepsy, whether it is a stranger, a friend, or a family member, or even you yourself could have epilepsy. In the world, there are over 65 million people reported to have epilepsy. However, we do not know the amount undocumented. No one person with epilepsy is the same. There are different types of seizures and different types of epilepsy. Because of this, epilepsy is classified as a spectrum disorder. When determining the causes of epilepsy, it can be difficult. 50% of people don't know the cause of their epilepsy. Out of the known causes, some forms are genetic. Seizures like absence seizures, which you appear to be staring off into space for a few seconds, are considered to be genetic. Brain injuries and trauma can also cause epilepsy. This can be anything from a failed brain surgery to hitting your head too hard. Developmental disorders and prenatal injuries are also thought to cause epilepsy. And here are some more statistics on the disorder. There is a 1.6 to 3 times higher risk of death in people with epilepsy. Repeated seizures can lead to imminent injury or death, and if a seizure lasts longer than 5 minutes, it is considered a medical emergency. Now, how does mental health come into play with people with epilepsy? Unfortunately, mental health is much worse in epilepsy patients than in the general population. Let's say that you had a world filled with only epilepsy patients. This would be about 65 million people. 30 to 50% of those people will develop mental health problems in their lifetime. Now compare this to only 8.5% of the general population, which will exclude all people with epilepsy. It's a big difference. There are 4 commonly recognized mental health disorders in epilepsy. The first most common being depression and the second anxiety. Depression is the most common in epilepsy patients. There are 2 ways to see depression in epilepsy patients. The first as a side effect of seizures, and the second from a mental health standpoint. The cause of depression as a side effect in epilepsy is unknown right now. And another way to look at this is from the mental health standpoint. When examining depression in different ages, it was found that children react to depression differently than adults. While the standardized depression symptoms are sadness and tiredness, in children, they tend to be angry and lash out and can be very aggressive. Adults generally have the standard depression symptoms. Anxiety is the second most common mental health disorder with epilepsy patients. It may affect a patient's ability to cope with the symptoms of epilepsy, therefore enforcing negative coping habits. One of these habits can be psychogenic seizures, which are seizures triggered by psychological events. These seizures are untreatable by medication because they are purely psychological. The third and fourth most common problems are ADD and ADHD and autism. ADD and ADHD can be really hard for epilepsy patients to deal with. Not only do they have to deal with the symptoms of their epilepsy, but now they have to deal with the symptoms of something that can make them hyperactive. Epilepsy can already have an effect on the learning curve of a patient, but ADD and ADHD make it even harder for them to learn. Other children may misunderstand ADD and ADHD for weird behavior, and this can lead to even greater bullying in a child with epilepsy. With autism, it can make things even worse. Communicating is more difficult in children with autism, and they have different ways of learning. Because autism is another spectrum disorder, there are different levels at which autism can affect a child, whether it is barely noticeable to extremely obvious. On average, there are 360 suicides per day. So why am I telling you this if I'm talking about epilepsy? The average rate of suicide in people with epilepsy is 2.6 to 5 times higher than the general population. In a 2011 study, it was found that 11,000 suicides were committed, and 976 of them were performed by people with epilepsy. Knowing that suicide rates have increased over the last decade, imagine what the statistics are not only in 2023, but with all 50 states combined. When looking at the factors that affect mental health in people with epilepsy, there are two main categories: internal and external factors. The internal factors are things such as genetics and biology. Seizure types can also affect the behavior of a person with epilepsy. Today I will mainly be focusing on the external factors. The external factor we are most familiar with is bullying. During my research, I have found that there are 3 main steps to the bullying process in a person with epilepsy. First, there is the general reaction of an onlooker to a seizure. Next, there is the misunderstanding of the disorder. And lastly, there is intentional bullying. The first stage, as mentioned, is the general reaction of an onlooker to a seizure. It may not seem like it, but your reaction to someone having a seizure can highly impact how a person with epilepsy views themselves. The worst type of reactions to seizures are seen in children. Because they are still learning how to act in a social environment and do not fully comprehend that their reactions can be taken negatively. Children might panic when they see a classmate having a seizure. The child with epilepsy might interpret this fear as judgment and view themselves as weird or not normal. The second problem is misunderstanding epilepsy. Generally, people tend to misunderstand the condition, making them make unjust judgments. For example, a child might witness a seizure and be terrified. Children tend to combat their fear with jokes and stories to connect the dots in their heads. Of course, you can't blame a kid for not understanding something that most adults don't understand. This can soon lead to bullying in a child, whether it is unintentional or not. Lastly, there is intentional bullying. Unfortunately, there will always be those who bully and tease just for the sake of doing so, no matter their level of understanding of epilepsy. But why might someone bully someone with epilepsy? Here are the whys of bullying. Children with epilepsy have a harder time learning. Developmental delays may be a result of seizures. This can make learning challenging for students with epilepsy. If another student is watching, they might tease because they don't understand there's a reason the child with epilepsy is slower to understanding the material learned in class. Next, there are the seizures. As explained before, the bullying may be a mechanism that children use to combat their own fear of witnessing a seizure. However, some children may not watch and be fearful, but instead think that a child with epilepsy is weird. Now, as we all know, when children have an opinion, they generally don't keep it to themselves. This can lead to mass bullying. Next, there is protection. Because children that have violent, convulsive seizures can injure themselves easily, they tend to wear protection such as helmets to school. There was one case of a child who was physically bullied all because he wore a helmet to protect himself from the injuries that his seizures can cause. Lastly, there is the stigma of epilepsy. Most times, people tend to view patients with epilepsy as unable to do normal activities. It is true that there are certain activities that some people with epilepsy can't perform, but it doesn't mean that all people with epilepsy can't live normal lives. In fact, most people with epilepsy can live full and normal lives, and they are able to do things that an otherwise healthy person would be able to do. But because most people misunderstand the condition, they tend to discriminate against people with epilepsy, whether they are just concerned for their health or discriminating for the sake of doing so. When analyzing the solutions, it can be tricky. Unfortunately, bullying isn't something that can just be cured. As long as humans have an emotion or an opinion, there will always be bullying. The question is how we choose to respond to it. The first solution is to stop bullying right from the source. If you see it happening, stop it. Next, we need to educate people about epilepsy. When teenagers were asked what epilepsy was, only half of them knew what it was. 2/3 of them said they wouldn't know what to do if they saw someone having a seizure. Now, if teenagers don't know what to do, how can we expect young children to understand? The best technique is to gently explain to them there's a child with epilepsy in the room and explain it to them as best as possible. Third, we need to know what to do when someone has a seizure. In elementary school or middle school, you probably learned CPR. Well, seizure first aid is just as important. If someone started choking in the room right now, there would probably be a lot of you who'd get up and help because you knew what to do. But if you walked outside this room right now, would you know what to do if you saw someone having a seizure? Here are the basics of seizure first aid for someone who's having a convulsive seizure, which is the most noticeable type. First, don't panic. It's most likely the person having the seizure will also panic as well. Turn them to their side and don't put anything in their mouth. Most people think that the person having a seizure will swallow their tongue, but it's simply not true. If you put something in their mouth, they could choke. Also, you don't want to leave them alone. Just be there while they're having a seizure. Most people who have epilepsy say when they're having a seizure, they never want to be left alone. Stay during and even after the seizure. If the seizure lasts longer than 5 minutes, call 911. Lastly, medication has been used to treat people with epilepsy and to help them cope with their mental health problems. Antidepressants are commonly used, however, they are not always safe. The medication can often mix with anticonvulsant medication that people with epilepsy take to combat their seizures. This can either lead to a toxic bloodstream or lower the efficiency of the anticonvulsants. Oftentimes, it's a choice between mental health and life itself. So if you would like to learn more about epilepsy, I do have some resources here for you to scan. First is my podcast, where I try to raise awareness to epilepsy. The second is Cure Epilepsy, which has tons of information if you would like to learn more. The next is Epilepsy Foundation, where you can become seizure first aid if you would like. And Under the Lights short film, which highlights many of the topics that I discussed today. It is really inspirational, and it was what inspired me to pursue epilepsy research. So thank you for listening, and I hope you all have an amazing day.